Now your child has full set of baby teeth. We're looking at a total of 20 teeth come in the mouth, and at this point, many times parents will wonder that, well, if we're going to lose our baby teeth anyways, then why do we have to bother even treating them? And I'm just going to explain the importance. When we end up getting cavities on baby teeth, before it is time for the baby tooth to actually come out of the mouth, it's important to consider many aspects. First of all, when you have a cavity in the tooth, as the cavity gets bigger and bigger, if it hits the nerve inside the tooth, this can end up causing infection. And at that point, your child will be in a lot of discomfort, and it can cause swelling, and overall it's not healthy for your child to let a cavity go like that. So it's very, very important that the minute you notice any type of hole or darkening on a tooth, you should really go and see your dentist right away and have it evaluated. Simple fillings will take care of this problem, and nowadays, there's many different options available to you of different types of filling materials. Most popular now are tooth-colored materials, which once the filling is done, it's not even noticeable that your child even has a filling. But coming to another side of this, which I'm going to show you, I'm going to illustrate this. We have one baby molar, and then we have a smaller baby molar, and then we got our corner eye tooth here. Now, when you're looking underneath these baby teeth, there's actually adult teeth, grown-up teeth forming. So we have like a grown-up tooth here, and a grown-up tooth here, and we have one over here. And then behind these baby teeth, there's an adult molar, which we call the 6-year molar. The 6-year molar basically will be erupting at 6 years of age, usually around that time. And it will erupt actually right behind the very last baby tooth that you see in your child's mouth. Now when the 6-year molar comes in, we want it to come in into the correct position. Now you can imagine if we were to lose this baby tooth early, this 6-year molar will actually start to drift and grow in an inward direction, thereby taking up the space that this baby molar was holding. You can see directly underneath this, there is a premolar that's forming. And if this molar starts to drift in, then this premolar has no room to grow in. And then we've got an even bigger problem in that we've got a premolar that's totally impacted. It's stuck underneath. And then, when your child is at a point of all the adult teeth are ready to grow in, we'll have some teeth that are stuck. And the only way to treat this would be through full orthodontic treatment to move those teeth back into their correct position. So basically, that's why if we, end up losing a baby teeth sooner than it should come out, basically it could cause a greater problem. If we do by chance end up losing a baby tooth much sooner than it's time to come out, there are ways that we can treat this, and there are devices called space maintainers. Space maintainers basically are devices that will hold the gap. They will hold the teeth and prevent them from drifting. And once the adult tooth starts to make its way in, then the space maintainer can be removed very easily. Let me show you again a diagram. If we have our baby molar and we're missing the molar in front of it, we've lost it due to infection, and then we have our eye tooth in front. Now, to prevent this baby molar from drifting inwards, a space maintainer is like a band that is connected to a wire that will stop at this point. There'll be a stop on that wire, and basically that band will be glued in around this molar, and it'll just hold this molar from drifting in. It can be very easily, once this grown-up tooth starts to make its way through the gum, then this band can be removed very easily.